Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics. I hope your 2015 has gotten off to a great start. I really hope that you had the opportunity last week to catch the Friday Focus in which we talked about when a child should have their first orthodontic screening. In our Friday Focus last week, what we talked about was children should have their first orthodontic screening at the age of 7. Now, what's really interesting is that sometimes that doesn't occur. And so then the question becomes, when would be the most appropriate time if you haven't brought your child in at the age of 7? And so if you have children at home that are at the age of 9 or 10, whether they're boys or girls, it's a really important time for us to see the children for an orthodontic screening. The reason that we want to see children also at the age of 9 and the age of 10 is that we want to start to evaluate whether your children have enough space for their canines. In other words, canines are your eye teeth. And so one of the things that we want to do at that visit, at that screening, is take a panoramic x-ray. And a panoramic x-ray is an x-ray that an orthodontist takes that we use to evaluate whether a child has enough room for their canines to come in. And this is something that we do complimentary at our exam. And so what we want to do is we want to evaluate, does your child have enough space for their canines? And so one of the things that we want to avoid, and I think this is we don't want our children to have fangs, right? And those are when your canines come in really high in the gums. And we kind of have this like sort of Dracula appearance to our children. And so that is really what we're out to check when the children are at the age of 9 and 10. So do you have enough room for your canines? Now, one of the things that we want to do is we want to make sure that the canines have enough space to come in the right type of tissue in the gums. Now, there are two types of gum tissue, and there's one type of gum tissue that's hard and pink, and that's the gum tissue that we want our canines to come through. And then there's another type of gum tissue in the mouth that has a lot more blood vessels and it's more vascular, and sometimes canines, if they're led to their own volition, they will actually come through that type of the tissue. And the reason we want to try to avoid that is because later on in life, children will end up having gum problems that we can avoid by just doing treatment at an early age. And so why you want to have the screening done is a lot of times when children have canines that come in a high position, or like what I say, fangs, then if you go to the wrong office or you go to the wrong doctor, one doctor might suggest that you need to have other teeth removed in order to make room for your canines. And that's one of the things that we really want to try to avoid. And God forbid, actually, in some cases, we get some crazy notion that sometimes that they should just pull out the canines. And I just want you to rest assured that that does not need to happen. And so when we're trying to make room for the canines, what we try to do is we use partial braces. And the idea is to really create some expansion which will facilitate the teeth to come down. And so in our office, what we do at the age of 9 or 10 is we make an assessment. Does your child have enough space? And do the canines, as they're coming through or in the x-ray, are they angulated or are they straight up and down? If they're straight up and down, then we feel more confident that your child may not need to have any type of intervention treatment at that time. If the canines are a little bit more angulated in the x-ray, then we kind of start to worry. And when we worry about that, what we're worried about is we're worried about the teeth actually becoming impacted. Or even worse, even sometimes if the canines come in too closely or they don't have enough space, they'll actually start to damage the roots of other teeth. And so this is one of those issues that becomes very complex. And it's one of those issues that if we can kind of create that space and make space for those canines, some of those potential problems can be avoided. Now, there are times where you can't avoid it. And so, and those situations do arise, and those are things that we would actually talk you through. And so, what I'm asking you to do is, if you have a child between the age of 9, 10, even 11, and they haven't done their orthodontic screening, then you really want to bring them into the office for a complimentary exam. Because this is one of those things that I think that if we just intervene early, we can reduce the severity of future problems and actually reduce the cost of future dental treatments. Like, one of the things that you do want to avoid are extractions, gum surgery, and so those are the things that really you can prevent by having an evaluation done at the age of 9 and 10. Well, thank you very much. This is going to be your Friday focus for this week, and we look forward to seeing you in the office. And if you have any questions at any time, feel free to call us at our office and talk to us, and we can give you as much detail as you need. Thank you so much. Have a great weekend, and we'll see you next week.